Thank you for your kind introduction. I am Wolopong Manaskiat from Bangkok, Thailand. I'm going to share with you a long-term follow-up on the efficacy and safety of using monopolar RF to treat moderate to severe acne vulgaris. I do not have any conflict of interest to the care. So acne is one of the top 3 common diseases that we see in our practice, and there are some group of the patients who do not respond to the standard treatment who are getting trouble from standard treatment. In Thailand, I've been using monopolar RF for doing facial tightening for almost 20 years. One thing that we do observe is whenever patients get treatment for skin laxity, they also come back and telling that they have improvement of their pore size, and they also have decrease of the oiliness on their face. We published a study in Laser Surgery and Medicine last year, and in this particular study, we provide monopolar RF treatment to tighten the pore, and we found a significant reduction of the pore volume, like after just 1 treatment, and continuously decreased up to 6 months after 2 treatments at the percentage of 38%. And we also measured the sebum production, and we saw significant reduction of sebum production at about 40% at 3 to 6 months after the 2 treatments. So if you look at our facial skin, we do have sebaceous scan, and we believe that with the bulk heating of monopolar RF, it more or less have some heating effect on the sebaceous scan. And if you look in the literature, during the past 20 years after the launching of monopolar RF, this was the only one study showing the efficacy of using monopolar RF for treatment of active acne. But unfortunately, this study did not have consistent of the number of the treatment or consistent of the follow-up visit. If you look at the heat profile of monopolar RF, it can heat up to a level of 4.5 millimeter. And at this level, it more or less can heat up the sebaceous scan. So in this particular study, we treated 20 patients with moderate to severe acne vulgaris. All patients received 2 treatments at 1 month interval. We follow up the patient at 1 month after 1 treatment, 1, 3, and 6 months after the second treatment. We did acne count. We did sebum output production by using QR sebum meter. We measure the pore size. We also evaluate the quality index of the patient. So this is the demographic data. The average age of the patient was 26 years old. Most of the patients were female. And the duration of the acne was about 4 years. And the pain score after 1 hour of the numbing cream at the first treatment was about 5. At the second treatment was 4. And the number of passes that we use, we start doing full pass of the full face treatment, and then we do another 2 to 4 pass up till we see the dark redness of the inflammatory lesion. In average, we use about 230 pulses for doing acne treatment. And this is the end point of the treatment that we use the erythematous turn to dark redness after the treatment. So we did acne count, and we found significant reduction of inflammatory acne, about a maximum of 46% at 6 months after second treatment. Unfortunately, we did not see any response on the non-inflammatory count. And we also saw significant reduction of sebum output, like after just 1 treatment, and the reduction of sebum output continued up to 6 months after second treatment. We also have the patient evaluate the oiliness, and this is the degree of oiliness that decreased. The patient have significant reduction, about 80% of the dermatological life quality index. And this is a patient in the study looking at the progression of the improvement at baseline, 1 month and 6 months after 2 treatment. Another patient that have quite a severe inflammatory lesion, and look at the improvement at 6 months after 2 treatment. Another patient who led herself having 100% of improvement of her inflammatory acne. So if you were to compare this result of monopolar RF to the sebaceous gland targeting, now we are at 1 year follow-up, At 1 year follow-up, we see 83% reduction of inflammatory lesion compared to 79% with the seabed scan targeting laser. So in conclusion, monopolar IF is safe and effective for treatment of moderate to severe acne. We believe that the mechanism of action is the bulk heating in the dermis, and we also get added benefit of reduce of the facial oiliness and reduce of the pore size. Thank you very much for your attention.
Thank you very much. Thank you very much, Dr. Wolfgang. That was great. Very, very interesting results. So the next talk is acne and lasers, comparison of FDA-cleared devices for in-office acne treatment. It's actually one of our uprising young stars, I guess, a medical student from University of Minnesota, Sarah Osborne.
Thank you for the introduction. Again, my name is Sarah, and I'll be discussing acne and lasers with you all today. Here are disclosures for Dr. Kelly. Acne, as you all know, is an inflammatory disorder of the pilosebaceous unit, and treatments typically include topical and oral therapies, but light and laser-based devices have also been used for decades to treat acne vulgaris. And what's really exciting about light and laser-based devices is that there's been a twofold increase in the clearance of devices for the treatment of acne over the last 5 years. And this point is further illustrated by this study, which provided an update on the use of lasers and light-based devices in the management of acne. And since this was published just 2.5 years ago, there have already been new devices with novel technologies that have hit the market. So given the rise in new products and technologies, our first objective was to identify FDA-cleared devices indicated for the treatment of acne since 2022. And then our second objective was to elucidate clinical evidence for safety and efficacy for each device. We did this by conducting an FDA 510(k) database search using the code GEX representing laser instruments. We then reviewed devices cleared between January 1st of 2022 through the end of 2023. Devices indicated for treating acne vulgaris were included, and those lacking this indication were excluded. And the respective company for each device was contacted using the protocol in the bottom left-hand corner of the screen. The devices were included if the company responded to us, and the provided data and device websites were then reviewed. There were 105 devices on the FDA 510(k) database during our specified timeframe with the code GEX, and of those, 12 were indicated for the treatment of acne, and 7 met our final inclusion criteria. This is a busy slide with our results here, so I'll guide you through it. On the far left-hand side of the screen, you can see the specific devices, and right next to that, you can see the company that manufactures that device. If you remember, our first area of interest was efficacy. There was one device in which we received only short-term data, but even with 5 weeks after treatment, there was a 75% reduction in acne lesion count. For the other devices with long-term data spanning from 12 weeks to 52 weeks, there was at least a 90% reduction in lesion count, and for some that was greater. Our other area of interest was safety. In all the studies we reviewed, there were only minor side effects such as erythema and edema, and there were no serious adverse events reported in any of the studies. Now, as we were going through the various papers, we noticed that there were other metrics that were being discussed in some of the papers, and so we wanted to highlight a few of those metrics here. The first is histopathology, and for some of the studies, they found complete destruction of the sebaceous gland. Others found inactivation of the sebaceous gland. Other studies looked at inflammation and found decrease in generalized inflammation, as well as decrease in specific inflammatory markers. Other studies found decreased sebum output. And then lastly, one study found psychosocial improvement following 3 months of treatment. On the far left, you can see these were 3 devices in which we heard back from the company, but we were not provided data on these specific devices. But we do want to point out that these devices are based off predicate devices, which either these predicate devices or devices that these are predicated on received clearance for efficacy and safety at some point. In conclusion, for efficacy for the devices that we reviewed, for the data we reviewed from each device, those with only short-term data had 75% acne reduction. All devices with long-term data had 90% or greater acne reduction. And of note, there were no head-to-head comparison studies, so we can't say for sure if one device is superior to another. In terms of safety, there were only minor side effects. There were no long-term side effects or serious adverse events in any of the studies. And then for the other metrics where they were reviewed, they saw histologic improvement, psychosocial improvement, and reduced sebum production. Some limitations we wanted to point out was that the absence of data provided does not necessarily indicate that there's insufficient evidence for the safety or efficacy of a particular device, as some companies may want to safeguard confidential or proprietary information. Additionally, the study is limited to medical devices that were cleared only in the last 2 years, so devices cleared before this time frame were not reviewed in our study. And then lastly, the type of clearance submission, whether it be a 510K clearance or a de novo submission, may have different evidence requirements and thus different levels of data provided. Thank you for your time and attention.